The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video is going to show how to assist someone from a supine into a sitting position at the edge of the bed. In this video, the patient will start out supine on a flat bed. If the patient is not going to have a hospital bed at discharge, it is useful for them to practice this skill from a flat bed and also without a rail. However, there may be instances where you may choose to raise the head of the bed up to make the transfer easier for the patient and for you. Most likely, if you are assisting someone into sitting at the edge of the bed, it is in preparation for leaving the bed. While this video does not specifically show this, it is recommended that you gather items that you may need for any next steps prior to having the patient sit up. Examples of necessary items would be a gait belt, assisted device, non-slip socks, or a wheelchair. If you obtain these things prior to assisting the patient into sitting, you won't have to leave the patient unattended and potentially unsafe at the edge of the bed while you collect the items you need. To transfer the patient from supine to sit, first raise the bed up so that you don't have to flex through your spine while assisting the patient. Raising the bed allows you to be closer to the patient while more easily maintaining the natural curves of your back. Then, lower the bed rail down so that it is not in your way as you assist the patient. Leaving the bed rail up will make it difficult to get close to your patient to physically assist her while still maintaining a proper back position. Have the patient bend her hips and knees. Then, the patient can initiate the roll by reaching across her body with the opposite arm and letting her legs fall to the side. You may need to assist by holding on to the shoulder girdle and pelvis or thighs as you shift your weight backwards. You should not pull on the patient's arm to prevent injury to that limb. Once the patient is in side lying, instruct her to push against the bed with her hands and elbow as you assist in bringing her legs toward the edge of the bed. Gravity will assist the legs down as the patient moves into a sitting position, but it will be important for you to also control the descent of the legs. You may do this by supporting the patient's legs on your own thigh or with your hands. Here's a close-up of the patient's hand position in side lying. The patient is going to push with the uppermost hand and the lowermost elbow against the bed as she assists in coming to the sitting position. Once the patient is sitting, lower the bed so that she can scoot forward and place her feet flat on the floor. This will improve her sitting balance. You will also notice that during this time, I am staying close to the patient and keeping a hand on her trunk to assist her sitting balance. If two people are needed to assist the patient with transfers, one can simply control the legs while the other assists at the upper trunk during this transfer. Both caregivers would be positioned on the same side of the bed. In some cases, you might consider leaving the bed rail up during this transfer because some patients will be able to effectively utilize the bed rail to assist them with rolling or pushing up into sitting. However, if the patient will not have a bed rail at discharge, lowering the bed rail will allow the patient to practice the transfer in the manner they will need to complete it at discharge. For safety, once the patient is sitting, Pause briefly before initiating any other movements. This way, you can assess the response to assuming an upright position. If they feel lightheaded, obtaining a blood pressure may be indicated to determine if the patient is experiencing orthostatic hypotension. It is also safest to stay close to the patient at this time, observing them and keeping a hand on their shoulder so that you can see and feel if they are struggling to keep their sitting balance prior to initiating any other movements.